Good morning, everyone, and welcome to another edition of Ask the SCSA. My name is Joanne Davis. I'm a safety advisor from the Regina office. Welcome. I'm going to do a short introduction of our panelists today. We have Mike Moore from Advisory Services, Lori from Program Services, Justin from Advisory Services, and Adam from Training. And we're going to start off right away with a presentation from Mike.
Thanks, Joanne. We'll just get the presentation loaded up. Before we start our presentation on the standardized protocols for Saskatchewan, I just want to go through something that's going on in Saskatchewan. We have the provincial NAOSH event that we're taking part of on May 7th, 12 to 1:30 p.m. We have guest speakers include Colin Poular from the SCSA, the Honorable Charlie Clark, Mayor of Saskatoon, Canadian Mental Health Saskatchewan, presenting Coping in Times of Change, and more to be announced. Stay posted by following us online at scsaonline.ca. Okay, strap on your boots. Their presentation we're going to get started on is on COVID-19, the standardized protocols for Saskatchewan. And you can find this on our website under resources/COVID-19/guides and manuals. The COVID-19 standardized protocols for Saskatchewan outlines the best practices for construction sites in order to maintain the health and safety of all workers required to perform duties during the COVID-19 crisis. The protocols, which include prevention, detection, response measures, as well as links to jurisdictional agencies, will minimize the impact of the crisis and ensure business continuity in the construction industry. These protocols are the Saskatchewan government's official recommendation for safety practices and costing in vertical construction for the duration of the pandemic prevention measures. Today, we're going to go over some methods and actions to consider to mitigate the risk of exposures on your site. The Saskatchewan Construction Safety Association is a member of the Canadian Federation of Construction Safety Associations, the CFCSA. The CFCSA works as an umbrella organization for provincial and territorial construction safety associations with a shared interest in promoting awareness of construction health and safety, improving information sharing, and collaboratively producing workplace health and safety training standards and information resources. To this end, the CFCSA will work with member organizations to develop joint strategies to move forward in these initiatives. The COVID-19 standardized protocol for Saskatchewan construction sites was developed in partnership with the Heavy Construction Safety Association of Saskatchewan, Sask Heavy Construction Association, WorkSafe Sask, Saskatchewan Construction Association, Merit Contractors Association of Saskatchewan, Saskatoon and Region Home Builders Association, and the Regina and Region Home Builders Association. The COVID-19 standardized protocol for Saskatchewan addresses the following objectives: prioritize the health and safety of workers and their surrounding communities, apply recommendations and best practices from federal, provincial, and municipal public health authorities to construction site procedures, establish and maintain a common pandemic response plan across construction sites, foster open communication among stakeholders, and ensure respectful work environment, maintain a healthy and effective workforce within the construction industry. Let's start by going over the responsibilities on site. Prime contractors have specific responsibilities for health and safety and must ensure that the activities of employers, workers, subcontractors, and any other parties at the workplace are coordinated. The prime contractor is also required to do everything that's reasonably practicable to establish and maintain a system or process that will ensure compliance with the Occupational Health and Safety Act and regulations. Construction employers and subcontractors are responsible for ensuring the health and safety of workers by putting policies and procedures in place to keep workers healthy and safe. They must provide workers with up-to-date instructions, training, and supervision on these policies and procedures. Prime contractors, employers, and subcontractors must have a process in place for workers to raise issues and concerns in general, and also specifically about COVID-19 exposure, so that additional precautions and controls can be put in place where required. Contractors are also required to conduct periodic audits to verify that appropriate measures have been implemented and are maintained. The frequency can be determined based on the project scale and scope. Outlined in this section of the presentation, we will discuss prevention measures. Let's go over such topics as communication and awareness, general control on site, site scheduling, and daily site operations, worksite and personal hygiene, PPE, travel, working remotely, and the service industry. Communication and awareness are crucial in ensuring all workers have the knowledge and training they need to protect themselves and others on site during this pandemic. All employers need to have COVID-19 policies and procedures developed for conducting work both on site and for those working from home. These policies need to include how the site will operate to minimize the risk of exposure, as well as clearly define the expectations of all persons entering the site. Policies must have provisions for contractors, cleaners, delivery, inspection services, and any others entering the site. Clear signage should be posted at entry points on the construction site and outline the commitment of the contractor to maintain health and safety measures during the COVID-19 crisis, with relevant updates from public health authorities and self-identification screening tools. All workers need to be trained on the policies and procedures on site. These should be covered at site orientations and reinforced regularly at site toolbox talks. Information is to be provided to employees working from home on how to prevent injuries from eye strain, improper working posture, as well as psychological well-being. If workers are feeling ill before work, they must contact their employer and not come to site. All employers are to verify the health of any individuals before entering the job site. On arrival, document the date, time, and purpose of being on site. We've created a short health questionnaire to be used on site. The following is stated at the top of the health questionnaire. To prevent the spread of COVID-19 and to reduce the potential risk of exposure to the workforce, please conduct this questionnaire daily at designated entry points or prior to accessing the site. This health screening applies to all trades, suppliers, union reps, employees, etc. Health screening is voluntary. However, any person who refuses to answer the screening questions will be denied access to our work locations without exception. Complying with these safety measures is in the interest of maintaining worker safety, and those choosing not to comply will not be permitted to work. The document is broken down into 3 sections. 1, general guidelines. This explains setting up a screening station. 2, the screening process questions. These are based on the provincial COVID-19 self-assessment tool. 3, the form containing the screening process questions, which includes the date, employer's name, worker's name, and contact phone number for the worker. It is comprised of 5 yes or no questions, which are: 1, are you experiencing any of the following? And then there's a list of symptoms to go through. 2, have you traveled outside Canada, including the United States, within the last 14 days? 3, did you provide care or have close contact with a person with COVID-19, probable or confirmed, while they were ill, with cough, fever, sneezing, sore throat within the last 14 days? Question 4, did you have a close contact with a person who traveled outside of Canada in the last 14 days who has become ill, with cough, fever, sneezing, or sore throat? Have you or anyone in your home had close contact with someone who is being tested for COVID-19 or who has been who has been diagnosed with COVID-19? If anyone answered yes to any of these questions, they're denied entry to the site and sent home to contact local health authority for further instructions. If an employee starts to experience symptoms while on site, they are to report to their supervisor immediately and will be sent home. The employee will be advised to complete the self-assessment provided by the Saskatchewan Health Authority. Information on the numbers to call in your specific area will be covered later in the presentation. Detailed tracking of worker status must be kept at all times. For example, fit to work, sick off work, to care for family, etc. This is important information that Saskatchewan Health Authority may request if contact tracking is required. Employees who have been ill will not be permitted back on site until advised it is safe to do so by the Sask Health Authority. Non-essential individuals and visitors are not permitted to access the site. And a side note, your local health authority is the leading authority for all issues related to COVID-19, and only they can provide detailed instructions to employees and employers on when it is safe to return to work. In order to keep construction sites operating in a safe manner, production schedules will need to be adjusted. Extra time will be required to implement enhanced cleaning protocols to maintain physical distancing and to allow for reduction of staff to illness or the need to care for family members during this time. Owners and trades will need to collaborate to ensure there's a clear understanding of how production will be adjusted and what the new site schedule will be. Employers should consider staggered start times, breaks and lunches, segregating sites into zones to keep different crews or trades physically separated at all times, limiting the total number of people on site or in the zone they are assigned to work in, limiting the number of people allowed in facilities like washrooms or trailers or eating areas at one time to allow for the recommended minimum physical distancing. Enclosed lunchroom facilities are only made available during inclement weather. All workers are encouraged to eat outside or in their personal vehicle if available. Minimizing the number of in-person meetings. When required, meetings are to be held outdoors while maintaining physical distancing. Where this is not possible, conduct meetings through tele or video conferencing. Designing the worksite to reduce high traffic areas to provide the minimum physical distancing. One-way staircases are established where practical to minimize worker contact. Freight elevators are operated and occupied by only one individual at a time, or where feasible, by respecting the minimum physical distancing guidelines. There are certain tasks that will require workers to be in close proximity to each other. Situations like this require extra time to allow for increased sanitation, minimization of contact, and application of PPE. Every effort must be made to limit the duration of the task. Work schedules are adjusted to provide time for proper cleaning and disinfecting as required. Additional sanitary measures need to be implemented on site. Hand washing stations should be set up. Signage on proper hand washing protocol. Hand sanitizer stations. Provisions of disinfectant wiping products. These type of facilities are made available on site entries, exits, washrooms, eating areas, offices, and any other area with commonly touched surfaces. Hand sanitization is mandatory before entering the site. Commonly touched surfaces on vehicles and equipment are thoroughly cleaned and disinfected at the end of each shift and between users. Limit access and use of shared devices like coffee machines, water fountains, microwave ovens, etc. A means to clean and disinfect each device between uses must be provided. Discontinue the use of common pens for sign-in sheet and site documentation. Consider an electronic means of sign-in. A designated person to record the information, or all employees have their own pen. Discontinue practice of passing paper around to be reviewed and signed. Washroom facilities, wherever possible, limited the number of users to ensure physical distancing is maintained. Where touch points like door handles and water coolers remain, paper towels will be provided to avoid skin contact to those surfaces. All offices and job sites need to implement additional cleaning measures for common areas. All door handles, railings, ladders, switches, controls, eating surfaces, shared tools and equipment, taps, toilets, and personal workstation areas are wiped down at least twice a day with disinfectant, such as disinfectant wipes. Individuals are responsible for cleaning and disinfecting their workstations, personal tools, and PPE. There's a sanitation checklist located on the next slide. This is the contact surface sanitization checklist. This is another resource available on the SCSA website. This document should be used to ensure a thorough cleaning is being done on all locations and facilities. However, do not limit yourself to only the items on this list. You must ensure that the list you use directly relates to your facility or job site. This document records when each surface sanitization is conducted, whether it is pre-shift, hourly, or end of day. It also records the location, employee in charge, the immediate supervisor, date and time, subcontractors, type of operation, and the size of crew, and who did the sanitization. Moving further into the document, the surfaces are broken down into 3 columns. Exterior surfaces, like all main entrance or exterior door handles, gate latches, handrails, etc. 2, general workplace surfaces, like pens for public use, public seating, filing cabinet doors, etc. And 3, personal workspace surfaces, like tape dispensers, phone buttons, and handsets or headsets, staplers, etc. At the end of the document, there's a section for review as well as comment. Like I had touched on previously, make sure you add to this document or revise it if it doesn't cover all necessary areas required to meet the needs of your workplace. Deliveries and products arriving on site. Delivery zones are clearly identified and limited to receivers and deliverers only. When possible, nothing is passed between the deliverer and the receiver, like shipping documents or pens for signatures. Deliveries are unloaded solely by receivers using the proper PPE, while deliverers remain in the vehicles. Where this is not possible for delivery of immediate use items such as ready-mix concrete or perhaps a piece of equipment, instruct the delivery personnel on site hygiene requirements and their responsibility under the policy prior to them coming to site. Define an area for laydown of deliveries. Small items should be disinfected before use if possible. Allow our larger items to sit, if possible, for the time recommended by health agencies for the virus to expire. All workers must exercise the following recommended practices for reducing the risk of transmission as identified by the Public Health Agency of Canada, Health Canada, and the Centers for Disease Control. Avoid touching eyes, nose, mouth, or face. If a worker must cough or sneeze, they should remove themselves from the area if they are near other workers if possible. Cough or sneeze into a tissue or the bend of your arm, not into your hand. Dispose of any tissues you have used as soon as possible in a lined wastebasket and wash your hands afterwards. Clean and disinfect frequently touched objects and surfaces, including all reusable PPE. Do not share personal items or supplies such as phones, pens, notebooks, PPE, etc. Avoid physical greetings such as handshakes. Maintain a minimum physical distance of 2 meters from others. Wash hands often with soap and water for at least 20 seconds before and after using the washroom. When preparing food and after blowing nose, coughing, or sneezing, and when smoking. If hands are not visibly soiled and soap and water are unavailable, alcohol-based hand sanitizer can be used. When you return home, remove footwear at the door, wash your clothes, and shower. With world shortages and other essential frontline services have mandatory requirements for PPE, a combination of good personal hygiene and site hygiene can reduce the need for pandemic-specific PPE. Refer to up-to-date information from federal and provincial health authorities on what's required. Continue to wear non-pandemic, basic, and specialized PPE as required by OHS regulations for your region. If a task requires PPE for protection against COVID-19 infection, select appropriate and approved items where possible. When a task is complete, have workers remove the PPE properly and sanitize it if it's reusable. If PPE is not reusable, make available lined waste receptacles and dispose of items. Wear latex or non-latex gloves only for specific tasks. Wearing gloves beyond task-specific use can lead to unintentional spread if frequent hand sanitization decreases as a result. If approved N95 masks are not available, non-medical face coverings, such as homemade cloth masks, should be worn as a potential mitigant to catching and transmitting the virus. It is important to note that these face coverings are not to be treated as substitutes for proper hand washing, physical distancing, and other protective measures. Remember that PPE always has been and still is your last line of defense. Non-essential business travel is not authorized. Business travel is limited and on an exceptional basis only. And all individuals returning from out of country must undergo a 14-day self-isolation period, as mandated by the federal government and outlined on canada.ca. In the event some provincial governments impose similar restrictions for interprovincial travel, any such requirements for self-isolation must be obeyed as applicable. Workers are not to share accommodations, such as motels or hotel rooms. Workers should travel to site using individual modes of transportation, so a personal vehicle or a bicycle. Where this is not possible, every effort to maintain physical distancing must be made, such as limiting ride sharing to 2 employees, with one in the front seat and one in the back seat. Keep windows cracked open to allow fresh air to circulate. Based on available information, it is estimated that COVID-19 can survive on hard surfaces from 24 hours to several days. It can be spread by touching a contaminated area, then touching the mouth, nose, or eyes before washing hands. Hand washing and respiratory hygiene are important ways to interrupting the transmission. Social distancing is the best method to prevent the spread of COVID-19. When this is not possible, employers should include vehicle cabs in their hazard prevention program. If a barrier such as plexiglass shield is not possible, PPE such as face coverings or masks should be worn. Maintain good ventilation inside the cab. Have windows cracked open. Refrain from using the recirc air option on your heating system. Have the driver open and close doors for each passenger. Provide seat covers that are easy to clean. For example, cover cloth seats with a wipeable seat cover. Avoid having more than 2 people in the front and 2 people in the back at a maximum. Ideally, if you're to share a vehicle, have only the driver in the front and 1 person in the back on the passenger side. Do not touch your face, eyes, or nose or mouth. Cover your mouth and nose with the crease of your elbow or a tissue when you sneeze or cough. Do not sneeze into your hands. Dispose of tissues and wash and sanitize your hands as soon as possible. Provide hand sanitizer inside the vehicle for occupants to use. Do not eat or drink while transporting workers. Minimize the number of vehicles shared by employees to limit the spread of the virus between different users of the same vehicles where possible. For example, have the same employees carpool together all the time and not switch around. Ensure that drivers have access to appropriate disinfectants, hand sanitizer, PPE such as gloves, and any other materials needed to clean high-touch surfaces in their trucks and implement recommendations. Clean and disinfect frequently touched surfaces inside and outside after each trip. For PPE, use disposable waterproof gloves. Avoid contact with contaminated areas and hand contact with the face, especially nose and eyes. Make sure vehicle interiors are clean and hygienic by wiping surfaces with disinfectant. The following equipment should be available for cleaning: disposable cloths, paper towels, disposable waste bag, labels and tape, cleaning agents and disinfectants. The checklist on our website includes such areas as keys or fobs, inside and outside door handles, inside door grab handles, pads and armrests, power window and door lock switches, radio and climate control buttons, seat adjusters, seat belts, and seatbelt release buttons. Any other parts that are commonly used that may have been touched. Example would be the glove compartment, the hood, the trunk, van panel, door handles, pickup tailgate handles. Dispose of soiled cleaning rags, disinfectant cloths, disposable gloves, and any other items used in the cleaning process in a disposable waste bag. Wash hands when finished using proper hand washing techniques. Reminder, refer to the safety data sheet, the SDS, for more information on the safe use, care, handling of chemicals used in the cleaning process. For example, disinfection agents may cause airway and dermal irritations, have strong odors, and present inhalation hazards while being sprayed. Where possible, all office employees should work remotely. Meetings are to be held through tele or video conferencing. Workers must be aware of the effects of eye strain and improper working positions. Workers must be monitored for signs of stress and mental fatigue. Workers should have access to mental health resources. We will cover some mental health resources near the end of the presentation. Many construction-based companies are required to perform service work at public buildings and private residences. In these situations, the employer cannot ensure that proper sanitization has taken place. Therefore, they must take extra steps to ensure the health and safety of themselves or their workers. Conduct a hazard assessment on the location where the work will be conducted. Extra time will be required to sanitize work area. Pandemic-specific PPE will or may be required, such as disposable gloves and face masks. Personal sanitization is required before entering and after exiting work area. Instructions are given to persons in the space to ensure they maintain physical distancing. Try to schedule work for certain times to limit exposure to workers, such as after business closes or during the day when a homeowner is not in the house. If the work is taking place in a home or occupied space, complete a pre-screening questionnaire with the owners or workers before entering the area. There's a questionnaire on the next slide. This is the COVID-19 pre-screening for service calls document. This document asks a few simple questions for the occupants to ensure the safety of staff, subcontractors, and clients. It is best practice to administer the questionnaire over the phone the day of the service call whenever possible. The yes or no questions asked to the occupants are similar to the health questionnaire performed by workers before entering the site. The questionnaire asks the property occupants. Question number 1, are you or anyone else on the property experiencing any of the following symptoms? And then there's a list of symptoms. Have you traveled outside Canada, including the United States, within the last 14 days? Did you or anyone on the property provide care or have close contact with a person with COVID-19, probable or confirmed within the last 14 days? Have you or anyone in your home had close contact with a person who has traveled outside Canada in the last 14 days or who has become ill? Question 5, have you or anyone in your home had contact with someone who has been tested for COVID-19 or has been diagnosed with COVID-19? And the sixth question are other symptoms with an area for them to list. The questionnaire also addresses that the questionnaire also addressed that if the answer is yes to any of the questions, that the employee conduct the service call is to stop work immediately and report to a supervisor. Having response measures in place ensures that you're taking a proactive approach to battling this pandemic, rather than taking reactive measures. In the following slides, we'll discuss what to do for possible cases of COVID-19 and response plans. Individuals have been potentially exposed to the virus or exhibiting flu-like symptoms such as fever, fatigue, coughing, or congestion are instructed to not come to work, contact their supervisor and/or human resources department, stay home and self-isolate, and contact local health authorities for further direction. Such individuals are required to follow the recommendations of the local health authority and may not return to work until given approval by proper health authorities. Individuals who begin to display flu-like symptoms while on site are instructed to avoid touching anything, take extra care to contain coughs and sneezes, and return home immediately to undergo a 14-day self-isolation period. All areas on site potentially infected by a confirmed or probable case are barricaded to keep individuals 2 meters away until the area is properly cleaned and disinfected. Employer may ask to provide contact tracking information to health authorities. Monitoring the status of workers is crucial during this time, and employers should keep detailed tracking of workers' status on site and off site are kept at all times, like fit for work, sick, off work for family caring duties, etc. A list of all quarantine workers is updated daily with their privacy maintained, and ensure records are kept of which individuals work together and when. All contractors are to complete an integrated continuity plan to respond to partial or complete shutdown of construction sites, or in the case of severe limitations on site operations. Here in this section, we will touch on some of the resources that the Canadian federal government, provincial governments, CCOHS, and the SCSA have made available. Living through the COVID-19 pandemic can cause anxiety and worry in all of us. Whether you're coping with the loneliness of self-isolation, concerned about the health of your loved ones, or worried about what the future may hold, there are mental health supports available to help you through this difficult time. Call Healthline at 811 for professional health, mental health, addictions advice, education, and support. It's open 24/7, confidential, free, and there's translation in over 100 languages. During the COVID-19 pandemic, CCOHS has made their mental health package free to all Canadians. CCOHS courses are unique in that they're developed by subject specialists in the field and reviewed by representatives from labor, employers, and government to ensure the content and approach are unbiased and credible. The following is a list of the free e-courses currently offered. Mental health awareness, mental health communication strategies, mental health and wellness strategies, mental health psychological safe workplaces, mental health signs, symptoms, and solutions. You can find these courses on the CCOHS webpage. The path is hazards/psychological/stress, and then click on e-learning. On April 15th, the Honorable Patty Hajdu, Minister of Health, launched a new portal dedicated to mental wellness on canada.ca/coronavirus and the Canada COVID-19 app. Wellness Together Canada will connect Canadians to peer support workers, social workers, psychologists, and other professionals for confidential chat sessions or phone calls, and will make it easier to find creditable information to help address mental health and substance use issues. The portal is the result of the work of broad consortium of organizations with experience in providing digital mental health and substance use support, led by Stepped Care Solutions, Kids Help Phone, Homewood Health, and Green Space Health. Wellness Together Canada is the first and only mental health platform of its kind for people of all ages in every province and territory. On the SCSA website, we have a toolbox talks available on dealing with mental health and stress during COVID-19, as well as many other topics. These can be found at www.scsaonline.ca/resources/COVID-19. Thank you for joining us today. I hope you learned some valuable tools to help you navigate the coronavirus pandemic safely. let's get back to Joanne and the rest of the panel for a brief Q&A.
Thank you again, Mike. Again, that document can be found on our website at scsaonline.ca under resources, COVID-19, coronavirus. Scroll down to guides and manuals and you'll be able to find that document. Thank you again. So we're going to go through a couple questions that are coming in and go to the Ask the SCSA session. One of the questions here I have is, it says, hi everyone, I really like your webinars. You guys are doing a great job. The question is, what is the best way to sanitize our PPE?
I think a really good way of doing it is either making, having disinfectant stations that are individual to the employees. So whether or not that, if you have access to sanitization wipes, each employee is issued their own little bucket of sanitization wipes, or the same way you would deal with hand washing stations where the water is expelled by a foot pump. You can use soap and water the same way you would anything else. Using a communal bucket or anything is not a good idea, as that's kind of a shared situation. So you want to make sure that anything you use as far as water or buckets to hold it in is being individual to that employee, and it's gotten rid of right away. It's the same as you would dispose of PPE in a lined basket. You want to make sure that that's disposed of immediately and that water is gone immediately.
That's great, Justin. I'll tack onto that, I think, too. With PPE, you can check with health authorities or people that are actually, if you have stuff that's being used in medical facilities, ask them what they're doing to do it. But your manufacturer of your PPE may be a great resource to contact the manufacturer. Make sure you're not using chemicals that deteriorate the PPE, things like that. So I would, for one, start at the manufacturer and find out ways that this stuff, and you may during that process find out that some of this PPE is non-reusable. So it's something to keep in mind.
Okay, thank you. Great answers. I do have another one here. It says, I had an SCSA employee call me and conduct a survey for fall protection. I think this is great and really appreciate the fact that you all look at industry for recommendations in helping build the course and make improvements. When might we see the new fall protection course?
I guess that one's going to be for me. As far as the fall protection, we have a new course coming out, as it was mentioned in the question, and we're doing our first test run this Monday. As long as everything goes well, we should be seeing that be introduced into our schedule, and then access for our members to be able to sign up for that class. So Monday will be the first class. Everything goes well, we'll start seeing it in our schedule. Just keep looking at our website for that, and also call an advisor. I'm sure they can help you out and let you know if anything changed with the schedule.
Thank you, Adam. I do have one here regarding audits. Our company is due for an audit at the end of June. Our work has been drastically reduced due to COVID-19, but more significantly, collapse of the oil prices in industry. How will this affect our core status? Will we still have an audit?
Hi, yeah, I'll take that question. As far as audits right now, the SCSA staff is not conducting audits. We are scheduling for July, August timeframe with the companies. We can basically set up a tentative date. We have to follow the restrictions or any guidelines that are in place at that time. So we are scheduling, we'll give an extension letter to the companies. So they will be covered for their course certification until the point where we can conduct the audit. Both ways, for our staff to be going out and also for the company to have a site that is running.
Thank you, Lori. I have a question here. what is the best way to have an employees sign toolbox talks and safety meeting documents since we're trying to minimize touching items? Any ideas?
It's a really good question. This is something that has been going around the table between not only the advisors, but a lot of companies out there. Right now, we're kind of going over some ways to do digital signatures. You know, it depends on what you're looking at, whether or not you're looking at the audit tool, which came up in discussion today, or you know, you're just trying to gain some documentation for your own purposes, considering things like orientations, toolbox talks, investigations. The best thing that you could do is move towards a digital version way of signing this. But there are also other ways of ensuring that, you know, say you were doing a toolbox talk and you wanted to make sure that all your workers that were there have signed on. You could possibly do things like having a supervisor do a head count and attendance records. We kind of discussed things on emailing the scanned document to each employee and having them do a digital signature, emailing it back and putting it in a separate category on your computer. There's a lot of different ways that we can go about this. Mike, do you have anything to add on that side of things?
Yeah, thanks, Justin. Great idea. The digital, we're moving into an era, I think, of more and more digital things going on, and I think employers would be prudent to look at their options. Even outside of COVID-19, I think that there could be a lot of positive changes. You know, such things as each individual person having their own pen and going by, you know, a table that it's taped down to and maintaining physical distancing while they're doing sign-ins. I think we want to be, health and safety. Look at my phone's ringing. If as well as physical distancing and all that is very important. So you want to look at a system in place that, you know, you can have some form of proof, if possible, that individual did do the sign in, that the individual was the one that did review the document or was at the meeting. For this moment in time, I think stay away from passing pieces of paper around and using common pens and that, and look at strategies in the interim until we can firm up something that's really going to work for your company, like such things as digital sign-ins and stuff. So.
Yeah, at the end of the day, Mike, yeah, you hit it on the head there. The big thing is that the employer has a responsibility to do everything that's practicable for the health and safety of their workers. So as long as you're doing everything you can to make sure that you're getting good attendance at your meetings when possible, social distancing is maintained, and we're keeping people from spreading COVID-19. I think anything you do at this point as far as documentation is going to be more than likely acceptable as long as you're doing everything you can.
Okay, thank you, Mike and Justin, for answering that question. Another question here with documentation. In regards to employees' health and time off, you mentioned to keep a detailed documentation of that. Do we have a form for that? Do we have one available?
Unless one was just released, I don't believe on our website we have a form specifically for that. This is one of those circumstances where there's do whatever you can, write it in a special place, your notebook or whatever, but tracking daily the health and well-being of your employees is extremely important. For example, knowing how someone was last Tuesday, things like that may come back, and those questions may be asked by the Sask Health Authority if they're doing contact tracing, or if you need to do your own internal contact tracing. And that, I think, detailed accounts of any physical distancing measures that have had to be broken as for tasks, and then also illnesses and the health and well-being of your employees. I think documenting that stuff, however you can feel adequate, I think is information that you need to keep.
Okay, thank you, Mike. Yeah, that's very well said. We may not have the form, but it's important for companies to, again, keep all their documentation and keep a good record of what is happening with that. I do have a couple training questions coming up for you, Adam. One is, I'm from Northern Saskatchewan. We're excited for online courses, as this will be a huge cost saving for a company. Will the SCSA be continuing with online training once this is over?
Well, I sure hope so. We've done a lot of work to be able to change our classes to be virtual, obviously for this, but we are getting great feedback from our members that they like this option. So if we or when we do get to go back to the classroom and teach in classrooms, we're probably going to be keeping a virtual side of this to be able to teach for our out-of-towners and anybody it's convenient for.
Okay, thank you, Adam. One more for you. When it comes to certification, is the online Fall Pro class the same as the classroom training?
Well, it's going to be a little bit different. The Fall Pro will be shown for the first time on Monday. We've gone around to be able to make it so that the qualifications for the class and for virtual are going to be the same. So we're going to be able to hand out the same certificate for a classroom setting or for a virtual one. So we've been able to work with that.
And a second part to that question, do I need anything besides my computer for that class?
For right now, I believe you're going to need a computer, and you're going to, I shouldn't say I believe, you're going to need your computer. You're going to need a harness, because you do need to still put on a harness. We still need to see it. We still need you to be able to inspect a harness. So for the most part, it should just be a harness and a computer for the fall protection.
Okay, thank you. Another question here. I just received work from my company. Do I need specific COVID policies? If so, is it something you can help me with?
Absolutely. I mean, that's what we're here to do, right? We have a lot of resources on our website, and one really good resource is the one we just showed you. That's all available on our website, the Saskatchewan Protocols for Working Construction. It's available through our resources tab. It's all there. If you have trouble compiling it into specific policies, absolutely let the advisory services know. There's a lot of us here that are able to help you.
Okay, thank you, Justin. Lori, I have a question for you. Is there any, is there any time in the future that you foresee a date when we'll be doing core audits again with some of the restrictions being lifted?
Right now, there's no plan B for core audits. We'll have to see how long this continues. That may be something that we'll have to look into. But for now, we are scheduling core audits as normal, just a few months ahead from now. And we'll have to see from there.
Okay, thank you. Got one more here. What is NAOSH? We mentioned that at the beginning of our presentation. Who would like that one?
NAOSH is North American Occupational Safety and Health Week. It's typically over a week period, the first full week in May. Typically, the SCSA, in conjunction with industry across Saskatchewan in different centers, we participate and help facilitate NAOSH events for the communities as a community initiative to recognize health and safety in the workplace. For all industries, in a lot of regions, in a lot of areas, we would typically have a barbecue every year and do an event with have maybe different displayers there, or people that are doing presentations or demonstrations, things like that. So it's an annually recognized week dedicated to health and safety. So this year we are participating in this one and helping to facilitate it for all of Saskatchewan. So it should be a good event, and I highly recommend people seeing if they can participate in it and taking it in. It should be pretty interesting and very informative and unprecedented. It's really interesting how the business community and reaches out and works together to navigate things like this during this time. So it's really a neat event in Saskatchewan, and how we're still moving forward with these proactive measures.
Thank you, Mike. I have another core question. I'm in the process for course certification. Is there someone I can send my manual to for review and acceptance? Or what number should I call to set it up?
Sure. Yeah, so if someone's working on the core process, before they can submit the manual, they would have to make sure that the 4 core courses are completed, plus those 2 proficiency, the pieces of homework. Then you'd be at the stage of submitting the manual. We are taking those electronically right now. They can be submitted to SCSA program info at scsaonline.ca. That's also the best way to contact us if they have to do other arrangements. If they don't have a digital copy of the manual that they can send in, we could go with mailing it to our Regina office. We can make some arrangements from there, but that route would take a little bit longer.
If I could just add there, Joanne, before you send in your manual, absolutely feel free to contact an advisor. Let us take a look at it. Let us take a look at your manual, make sure it meets all the requirements for core or C-core, and then that way we can also guide you in sending in that manual afterwards and making sure that you meet all the qualifications.
Yes, good point. Thank you, Lori. Thank you, Justin. Another question. I need a copy of my SCOT training. Is there someone still at your office who could send that to me?
Yes, the people can call the main Regina number or the toll-free line. Phones are being directed to the Regina office only at this point, and we do have some people manning the phones, and they can help you out with your training requirements.
Okay, thank you. Yes, even though we are mostly working from home, there is somebody in the Regina office again. Can I have 2 to 3 employees use one webcam for training they have coming up?
It is our recommendation that everybody has their own camera, or sorry, their own computer, which most likely has their own camera. We do have tests, we do have reaction forms on the training, we have registration forms. To have 3 people on one computer, that's going to slow down that process quite a bit. And then when it comes to test time, you can't have 3 people on one computer doing 3 tests. So it would be preferred that there would be their own devices. Can it work in some classes? Please call us. We're just at the beginning of this, so we're learning as we go as well. But right now it would be the recommendation, 1 computer, 1 camera, 1 person kind of thing.
Thank you. A question about NAOSH. Do I need to register, and what will I learn?
There's going to be more information for this. This is kind of as everybody knows, unprecedented time right now with doing NAOSH virtually. But we'll have some great speakers, which you will undoubtedly learn something from each one of them. But if you just keep going onto our website, as well as we have a webinar next Tuesday at the exact same time, 9 a.m. There'll be more information to follow on that. And again, follow us on Twitter, Facebook, Instagram, everything like that, just to kind of keep up with who will be there.
Okay, thank you. We have about 5 minutes left, so we'll answer a couple more questions. I heard last week you talk about fall protection plan. Where can I find a copy of a plan?
You can absolutely contact an advisor. We can definitely get you get you a copy of the fall protection plan without a doubt, and very quickly. It's located within our manual build program. So we have a program to help companies develop a manual. So that's something that we always make sure when companies work at heights that we give them a fall protection plan. So if you are in need of one, make sure you contact us and we'll make sure that we get you that resource really quickly.
In addition to that, I think it's important that there's a lot of with such things as Google in existence, there's a lot of people that may have Googled a fall protection plan and things like that. But those plans, I still think that it's definitely reasonable to go through those plans and compare them to legislation, compare them to Saskatchewan legislation. Make sure you have the components that you need in that plan, in the plan that you got off of the internet. Like Justin said, and other resources, you could always contact us and we'll walk you through that process.
Thank you, Mike. I have another question here. I have a hearing disability. Can I still take training online as I do best reading lips? I follow along with slides and books. Will the training work for myself and others with the same issue?
That's a good question. I would think so. Like, we stay pretty much visual. There might be a couple of things that we would have to change. I know that Zoom has some closed captioning options that we would have to look into. I'm not going to say no, we can't, but it would be something that I would have to look into, or the training department would have to look into to see what we could do. It'd be something that we can definitely get back to you on another webinar as well. I'll start looking into it right away. It's a good question.
Thank you, Adam. I do have another question here about sending a worker home for demonstrating symptoms. Can they refuse to go home, and do we know what steps we could take if that were to occur? I know it's a little deeper question here.
That is, I'll take a stab at that, Joanne. It's like, we're not lawyers at the SCSA. We're not the police department. We're not the health authority. When it comes to something as trivial, or not even trivial, as tricky as a situation like that, where a worker's refusing to go home as a result of showing symptoms, I think internally there's a lot of mechanisms that you may want to, that may prompt you to look into. I would immediately isolate that individual from all other workers and to an area. At least ask them to, if you mind, we're going to look into this. Can you wait in this area? And we'll dig a little deeper. And then have an emergency meeting with the decision makers on your site, and try to navigate through this. Get your HR department involved, and do your best to navigate. We are not in a position to give you advice on exactly what to do in that position.
Thank you, Mike. Yes, we do offer services for health and safety, but again, like Mike said, we are not the lawyers, and you need to also contact some other officials regarding that one. One final question. Do I need to print anything for online classes? I have a computer, but no printer.
No, pretty much everything is going to be a soft copy, PDFs. We've created our tests and our registration forms to be filled out online using a Microsoft form. So everything works out there. Manuals are going to be PDF as well. So as long as you're able to read off your manual, maybe you might need a second monitor, or you can flip from window to window. But yeah, for the most part, you won't have to. There are a couple of things, though. You have to remember that a couple of our classes, we do have proficiencies homework. So LSC and Safety Auditor, there is work for you to do. Now, both of these things can be done online. We do have fillable PDFs for both of them, so you still don't technically need a printer. But a lot of people like to print off, especially the audit tool when they're doing their audit. So you can still do it online, all of it, but you might prefer to print some of them off, so you might need a printer, but that would be at your own discretion.
Okay, thank you. And that is our time for this Thursday Ask the SCSA. Thank you again to all our panelists, and hope to see you next week, Tuesday at 9.